This plan by the UN coincides with World Cancer Day. Here in Australia, doctors at the Sydney Children's Hospital are trialling a new treatment they hope will pave the way for a cure to one of the most deadly types of paediatric brain cancer.
Levi Wheeler was a bright and bubbly 7-year-old boy.
Just a regular boy who loved his family, he loved his friends, and he really adored soccer.
But in 2017, he was diagnosed with diffuse intrinsic pontine glioma, or DIPG. He died a year later. It's a disease for which there is no effective treatment, with most patients dying within 12 months of diagnosis. But a new trial at the Sydney Children's Hospital aims to change that.
When you have an option, it gives you hope, and so this is what this trial gives families like ours.
Through a fund named in his honour, Levi's family has raised $4 million, some of which is supporting this Australian-first clinical trial called Levi's Catch. It involves a modified T-cell therapy, which uses the child's own immune system to fight the disease by training white blood cells to attack the tumour.
We then take those white blood cells to the laboratory where they're genetically engineered to actually fight cancer, to fight the DIPG. Those tumour cells, those white blood cells are then grown in the laboratory, and then we infuse them back into the child.
Doctors hope it will extend a patient's life by months or potentially years.
That may sound like semantics to some, but believe me, every second, every minute, every hour more with your child matters.
But ultimately, they have their sights set on a cure.
We will keep going until we actually start curing children. You know, this was done with leukemia. 50 years ago, leukemia was an incurable childhood cancer. And now, 90% of children with leukemia are cured.
Up to 40 children are diagnosed with DIPG in Australia annually. If successful, researchers hope to expand this treatment to include other forms of childhood brain cancer, which claim dozens of young lives each year, so that other families don't have to experience the same heartbreak. Kath Landers, SBS World News.